As anyone who's ever been inside of my house can attest, I'm a bit of a neat freak. And that extends past my countertops. I want to make sure my mouth and teeth are nice and healthy. So our favorite dentist, Dr. Artie DDS, is back to give us some information on how to properly care for those pearly whites. Welcome.
As always, it's a pleasure to be here.
Let's go back to the basics here. How often should I brush my teeth?
I would generally say it's great to brush 2 times a day. And the most important thing to know is how to brush. So lucky enough, I come prepared.
Oh, you brought your own. Yeah.
Never leave home without it. Generally speaking, the way you brush your teeth is really important. You never want to brush aggressively. And always make sure you have a soft, bristled brush. I always tell my patients to never hold their toothbrush using their palm. This uses your bicep, and that way you don't know you're brushing aggressively. But when you use your fingers, you'll actually feel the tension in your fingers, and that way you'll know you're brushing aggressively. So better safe than sorry, brush lightly.
Well, I have the most delicate touch, but for those who might be a little confused, can you explain maybe the proper direction?
You want to angle the bristles to go under your gums. So when you're doing your top teeth, try to have them at a 45-degree angle circular. Same thing goes for the bottom. Angulation should be 45 degrees, and try going under your gums in a circular fashion. When doing the tops of your teeth, you want to generally go in one direction. So you may rise, place down on the top, and exit. Rise, place down on the top, and exit. Continue this motion for about 2 minutes. That's the most effective way to brush.
What's the deal with mouthwash? Is it helpful at all, or am I just wasting time and money swishing this stuff around in my mouth?
There are many different types of mouthwash. Generally speaking, I like to use mouthwash that does not have alcohol. Alcohol dries the mouth. The more dry your mouth is, the more prone you are to cavities. So if you do want to use a mouthwash, irrigation is a great tool. I would buy one that does not have alcohol.
How often should I be flossing my teeth?
I would say the more you floss, the more healthy your mouth can be. Just be careful to not floss aggressively. There's also tools like the water pick that is a water flosser. But remember, flossing the old-fashioned way with the string is probably the most effective way to clean the in-betweens.
Say I've flossed, as I always do, and a little bit of blood comes out. What's that mean?
So generally speaking, when you see blood, it means one of 2 things. A, you're flossing really aggressively, which I hope no one does. B, it actually means that you're due for your checkup. Bleeding on flossing means that there's something irritating your gums. There's a type of inflammation. This is a sign for you to see your dentist and schedule an appointment.
In your opinion, what is the most important thing I can do to ensure my dental health?
If I were to leave you with a final message on how to keep a beautiful smile, a healthy smile, I would have to say the most important aspects are regular dental checkups, flossing, brushing, watching your diet, and things of that nature. So the bottom line is, if you take care of your teeth will take care of you.
Well, Dr. Artie, thank you so much for being with us again today.
It was an absolute pleasure, thank you.
And if you're looking for more tips on how to keep your teeth clean, check out our teeth tips video and find out what to do if you don't have a toothbrush handy. As always, thanks to our sponsor, Benefit Bar. And remember, keep those teeth nice and clean.